Hello, my name is Kaylee Cho. Today I'm going to talk about the FAP expression by immunohistochemistry in patients written by Dr. Gargas. So what FAP is the fibroblast activation protein that is strongly expressed on cancer-associated fibroblast. The reason that we're focusing on FAP is because this plays an important role in tumor progression. And what immunohistochemistry is, so this is the most common application of immunostaining. So by staining this FAP, we are able to identify the FAP expression across the various cancer. So Dr. Gargas studied the biodistribution study of radio-labeled, so they radio-labeled this FAP-PET. So they studied this radio-labeled FAP-PET imaging under the Radioactive Drug Research Committee. The purpose of this study was to define the biodistribution of radio-labeled FAP in normal and cancer cells to determine the FAP immunohistochemistry. So the radio-labeled FAP SUV and FAP immunohistochemistry score for both cancer and non-cancer were tested for correlation. So here we are going to more dive into the figure 3 that talks about the correlation of FAP immunohistochemistry, which is also known as IHC score, with the radio-labeled FAP SUV max, SUV mean in cancer and tumor-adjacent non-cancer tissues. So on the figure 3, you see the y-axis on the left side with IHC score and right side SUV max. If you see the figure 3B, you see the left side IHC score and right side SUV mean. So this radio-labeled FAP SUV max and SUV mean and FAP immunohistochemistry was all higher in cancer tissue compared to the tumor-adjacent non-cancer tissue. So for the cancer tissue, the SUV max was about 7.7, while the non-adjacent non-cancer, the tumor-adjacent non-cancer was 1.6. For SUV mean, it was 6.2 for the cancer cell, but it was 1.0 for tumor-adjacent non-cancer. And for mean FAP, immunohistochemistry score was 2.8 versus 0.9. So you can see it's a lot less in the tumor-adjacent non-cancer cells. So what this tells us is that this radio-labeled FAP SUV max for metastasis was comparable to their primary tumor, which tests that FAP expression is consistent across the primary and the metastatic lesion with each patient. So this supports that this radio-labeled FAP46 is a potential pancreatic cancer imaging biomarker for FAP expression. And this could also be used as the enrichment biomarker and useful for patient selection tool for the treatment purposes. So since this FAP is expressed across all 14 cancer types that was tested, and by comparing from and finding the correlation between the cancer and non-cancer, we can identify that this FAP expression is an important targeting tool for the treatment purposes. Thank you for listening to my presentation.